Welcome to A Different Frame. I'm your co-host, Anisha.
And I'm Kendra.
And this is a podcast for the people, by the people. Now, the show is made possible by Alabama Values Progress, a media advocacy organization that is dedicated to breaking the cycle of misinformation during the times where the truth is hard to find. Pretty much, we're out here delivering facts, data, and receipts on what's happening in Alabama. Today's episode titled, We All Need to Be Covered. Why is the Alabama Legislature holding out on health care for many Alabamians? And we are joined today by Robyn, ED of Arise, who has co-founded Cover Alabama, a coalition fighting for Medicaid expansion. And we're also joined by Debbie Smith, who is the campaign director for Cover Alabama. So let's dive into today's episode. Kendra, why don't you tell everyone what we have on tap?
Yeah, hey y'all. So today we will discuss the fact that Alabama is one of the states that has not yet expanded Medicaid under the Affordable Care Act, which has left some 200,000 Alabamians without health care coverage. As Anisha said, we're joined today by our friends from Alabama Arise. Robyn, who Anisha already let y'all know, she's the executive director of Alabama Arise, and she's passionate about engaging community members and directly impacted people in the policymaking process. And then we also have Debbie Smith, who is the Cover Alabama campaigns director. And Debbie joined Arise as a North Alabama organizer in 2018, and then she started her new position in 2022. We're super excited to have you both here with us on our podcast today.
Yes. Now, for listeners and viewers who may not know, Medicaid is a health insurance program that is funded jointly by the federal and state governments, and it provides health coverage to low-income individuals, families, and children, pregnant women. I had Medicaid when I was pregnant, and people with disabilities. Medicaid was initially created in 1965, and it has undergone several changes over the years. Now, despite the fact that, Medicaid is a vital safety net for many vulnerable populations, it is often stigmatized by policymakers and the general public. The stigma has a number of negative consequences, both for individuals who rely on Medicaid for their healthcare needs and for the broader healthcare system. One of the, primary reasons for the stigma around Medicaid, sometimes is the belief that it's a welfare program and that those who receive Medicaid are lazy or unwilling to work. Now, this belief is not, is not true. It also reinforces harmful stereotypes about poverty and people who live in it. And in reality, many people who receive Medicaid are working, but their wages are simply too low to afford private health, insurance. Others may have lost their job due to factors beyond their control. This was my case when I had my first son. Some may be on Medicaid, due to an illness, or may have lost their job due to an illness or just the changing, economy. So, this stigma around Medicaid has broader implications for the healthcare system as a whole. And by perpetuating the belief that Medicaid is a second-rate form of healthcare, policymakers, they may be less inclined to invest in the program, which can lead to inadequate funding or lack of resources for it, right?
I think that's a good point to pivot into diving into our discussion on why Alabama has not expanded Medicaid. The decision to expand Medicaid is ultimately up to each state. And while the federal government offers financial incentives to do so, some states have chosen not to participate. In Alabama, there have been several reasons cited for not expanding Medicaid, including concerns about the cost and potential for fraud and abuse. Additionally, some lawmakers have argued that expanding Medicaid would not actually improve health outcomes, and the state should focus on other healthcare initiatives. So I want to pose this question to you, Robyn. Why do you think that Alabama has continuously fought against Medicaid expansion?
Thank you for having us on today. First of all, for me and for Debbie and for most of us who've been engaged in this fight for more than 10 years now, the fight for healthcare is really personal. It's hard to understand why lawmakers can't see it the same way. For many of them, the bottom line has been money. We've done everything we can with our campaign, with our partners, with our research, to show that actually expanding Medicaid would not only be affordable for our state, it would save our state money in the long run. I think you cited a lot of the arguments that we hear commonly. There is a lot of stigma. It's worth mentioning that of the 11 states remaining who have not expanded Medicaid, 8 of those are actually in the former Confederacy. So they are the Deep South states. Georgia, Florida, Tennessee, Alabama, the Carolinas, Mississippi. And research has shown that in states where a disproportionate number of Black people benefit from public benefits, legislators and voters, white voters, are more likely to oppose extending those benefits, even unfortunately when it hurts white people just as much as it hurts Black folks. But I think we can't talk about this issue without talking about some baked in racist assumptions that go into people's opposition to investing in public programs. The good news, I will say, is that we are really pushing back against those harmful narratives. We've made a lot of progress. Last year in particular, we extended postpartum coverage to 1 full year, which is a huge victory for us. And many of our other southern states are following suit. North Carolina is poised to become, I believe, the 40th state, 41 when you count the Washington, D.C., to expand Medicaid. And they're very, very close right now with their Republican legislature. So we think it can be done despite these ingrained deep narratives. There's so much pressure on our state to expand. And all we can do is fight back with the best data, the best storytelling, and showing lawmakers that this really hits home for their district.
Yeah, and I love that you also highlighted the storytelling. I mean, as a media advocacy organization, we believe that it's important to center the voices of directly impacted communities, and also it's important to launch messaging that shifts or provides a counter narrative to the negative narratives that are out there. And to combat the stigma around Medicaid, it's important to educate the public about the realities of the program and to challenge those harmful stereotypes that I mentioned. And this can be done through public education campaigns. It can be done through podcasts similar to the one that's happening today, as well as by working with healthcare providers to increase access to care for Medicaid. But I wanted to just pose the question, Debbie, what are some of the ways that Cover Alabama is working to close the knowledge gap and shift the narrative around the stigma around Medicaid expansion?
Yeah, well, we're a coalition of 120 partners from across the state of both medical professionals, faith groups, community organizations. We really just kind of run the gamut of the different organizations that we have a part of the coalition. And so much of our work is just straight up education, straight up educating people on the research that is out there on Medicaid expansion, what we've seen in other states, from research that we have here from the Public Affairs and Research Council of Alabama, the research that's been done in state. So just a lot of education and a lot of getting folks to talk to their legislators about Medicaid expansion and educating them as well. So we did a grassroots advocacy training earlier this month for a lot of our partners that really talked people through how to go about speaking with their legislators about Medicaid expansion, talked through the numbers, the basics, the 101s of Medicaid expansion. And I think that was pretty successful and it's going to help people reach out to their lawmakers about this issue, which is what we really need to have happen to get it done.
Yeah, and Debbie, you speak about, just educating the public. And I think we all can agree that the importance of Medicaid expansion cannot be overstated. So I wanted to just dive into another question for everybody. What are some of the benefits of Medicaid expansion for Alabamians? Like, you all, let's just run the list. I know there's so many, and people here, contact your legislator and ask them to expand Medicaid. So what's the why? What are the benefits? Like, what are we missing out as a state by not expanding Medicaid?
I would just start by saying, first of all, we have over 200,000 friends and neighbors who do not have health insurance today because it's not affordable. There's another 120,000 or so who may have health insurance, but they're barely affording it. It's one of those employer-based plans with a high deductible. They're just scraping by and they're really even not sure it's covering what they need. So for us, we think immediately about folks who are dying or deferring care because they can't afford it. And the long term, the cost that has to them, their family and their community and people who rely on them, can't overstate that enough. We did a town hall last night in Bruton, which is a rural community. And a woman stood up and just said, look, my mother, she was a pastor's wife. My father retired from preaching. She went without health care for 7 years. She knew she had an issue. By the time she got health insurance, she was in stage 4 breast cancer and she died. And this woman is breaking down in tears in front of a room full of people saying, y'all knew my mom. This happens every day. And I can't even tell you, we've heard so many versions of that story. I think we've got to start right there with folks we know. Everyone has been touched by a premature loss, mental illness that was untreated, chronic illness that caused people to have to stop working or cut their lives short. To me, that's where we start from first, is just getting people covered. But beyond that, there's economic benefits, workforce benefits, and I feel like Debbie and I could probably jump in and list probably a whole laundry list of other reasons why we think it's a smart choice.
Yeah, absolutely. And I would just add to that, of course, that's the most important thing to me, is that people get health coverage, right? I want people to be able to see the doctor when they need to. I want people to be able to get the medications that they need in order to stay healthy, or in order to get healthy. And I think it's really important for both our workforce too, keeping a healthy workforce. It's so important for people to have access to their medications to stay healthy or get healthy so they can get to work. So it's just kind of the opposite of what we've heard about what you were mentioning earlier in the podcast about, people receiving this benefit and seeming like they're not working. No, actually, if they get access to Medicaid coverage, they'll be able to stay healthy and go to work. So that's like me. I have anxiety disorder, and if I didn't have my medications, then it would be very difficult for me to work. So I just want everybody in the state to have the same option to get whatever ailments they have treated so they can work or live their best life.
I know, like I tell people all the time, health is wealth. And if we're talking about a vibrant, thriving, state or this country, like we can't neglect health. We can't neglect healthcare. So thank you for sharing that, Debbie.
Yeah, health and benefits are super, super important to Alabamians. I know that there's been several efforts in the past to expand Medicaid in Alabama, but none of those have been successful. And I know that with the pandemic, there's been a huge highlight of the need for healthcare access to coverage. And I know there may be renewed efforts to expand Medicaid in the state. So I wanted to pose this question to you, Debbie. What do you think is next for Alabama and Medicaid expansion?
What do I think is next? Well, we're going to get done.
That's right.
Simple answer. I think we're almost to that breaking point. I think we're almost to that point where something is going to break through and convince the state legislature, convince Governor Ivey that this is finally the year to do it. I mean, we have so much research behind us and so much momentum behind Medicaid expansion that I just, I really believe that this year is going to be the year that we get things done.
So we're super big on getting people involved in the fights. So how can the general public get involved in the fight for Medicaid?
Well, I would encourage them to get connected with the Cover Alabama Coalition, which you can do that easily by visiting our website, which is coveralabama.org. One of the first actions that I suggest you take is to contact your legislators and Governor Ivey and tell them that you support Medicaid expansion. And that can be done by visiting coveralabama.org/alert. We have a pre-filled email that all you have to do is enter in your contact information, and it sends off an email to your state representative, your state senator, and Governor Ivey showing your support for Medicaid expansion. And we need them to hear from us. We cannot flood their email inboxes, their telephone lines enough to let them know that we support Medicaid expansion, and that needs to be done now.
No, definitely. Medicaid expansion is an essential aspect of healthcare reform. We have to do it. By expanding Medicaid for everyone, we make healthcare accessible and affordable. We're preventing people from going into medical bankruptcy. I mean, furthermore, Medicaid expansion has been shown to improve health outcomes and can also have an economic benefit as well. I mean, it is, crucial that states like Alabama expand their Medicaid programs to ensure that all individuals, every Alabamian has access to affordable health care. It's just critical.
Yeah, following up on that, I wanted to mention that Alabama has some of the highest rates of medical bankruptcy in the country. And when you map out which parts of the country have the lowest credit scores, they're all concentrated in states that have not yet expanded Medicaid. So there's a direct correlation between access to capital, access to individual and family wealth building, and expanding healthcare coverage. The other thing I wanted to mention is the disparate racial impact. I mentioned earlier that I do think racism is contributing to some opposition. About half of the people who would benefit from expanding Medicaid are people of color. But half of them are white folks too. This is not an issue that impacts just one community or one demographic. It is rural, urban, suburban, people in every community. Another thing to point out is even if you yourself have health coverage, a lot of the healthcare infrastructure around you depends upon other people being able to pay. So when there is a disproportionate number of people who just can't pay, what ends up happening is doctors' offices move away, hospitals close. So you yourself might be able to afford it. It's suddenly harder for you to get. And then more and more people are having to go to major cities to get health coverage, to get treatment. It just compounds the issue that the less investment we have, it hurts the entire fabric of communities sometimes. And when you go to the website that Debbie mentioned, coveralabama.org, you can also click on the economic impact report that was done by PARCA. It's coveralabama.org/economic impact. And you will see exactly how much money would come into our state, nearly $2 billion in just the first 6 years as a result of this kind of investment of federal dollars. It would save our state, I believe, almost double that when we think about other things we're having to spend just to keep people healthy.
Awesome. So I want to take a step back for just a second. I know we talked about one of the reasons that the legislature uses to not pass Medicaid expansion is the cost, but doesn't Alabama already pay for Medicaid in other states, or at least some of the money that they pay in goes to help other states with their Medicaid?
I know you lying. I know you lying.
It's funny how this is one of the most persuasive arguments, but yes, when you pay federal taxes, income taxes, those are going to help states including Arkansas, Louisiana, Kentucky, Oklahoma, Missouri, South Dakota just became the latest state to expand Medicaid. They are helping their citizens. They made that choice. We're paying in federal tax dollars and we are not getting that same benefit. So you may be confused if you moved here from another state, one of the 40 other states that has done this, like why it's worse here. This is a choice that we can make.
That's a lot. Well, thank you, Robyn and Debbie. We received a whole bunch of information from you today, super valuable insight on the need for Medicaid expansion in Alabama. And I would like to encourage our viewers and listeners to take a look at Cover Alabama website and see what they have going on.
Yes. But wait. Before we go, y'all got to get on the soapbox. The soapbox, this season is something new, season 2. This is the place where you have the opportunity to rant for 60 seconds. Feel free to tear a hole into whoever or whatever. But keep it clean. The kids are listening and watching, as they should be. They need this information also. So who wants to volunteer first?
Go first.
Yes. Okay. So, all right, Robyn. So you have 60 seconds. If you finish before 60 seconds, when you stop talking, you'll come back to the group. But you'll be put on the soapbox now.
My soapbox is about stigma. I think in our society, we are made to feel ashamed for needing help. So often on the issues that Arise works on with our partners, issues like people not having access to healthcare, people getting trapped in predatory debt, people having to pay exorbitant fines and fees just to avoid jail. People are so ashamed that they've been put in this situation that it's hard for them to speak out publicly. I think it's our role as advocates to go to people and say, you are not alone. if you're feeling trapped, if you're feeling hopeless, if you're in this situation, it's not all your fault. This is happening to other people, and here's what we can do about it. So my soapbox is about, if you want to connect with others, you have to be willing to be vulnerable and share your story. For me, it's that my husband lives with a serious mental illness. There have been times when he's dealt with suicidal ideation. He's lost close family to suicide. And so often when he spoke out about his own struggles with mental illness, people said, you know what, you don't need to talk about that. You need to tell your husband just to keep it to himself. That's y'all's business. That kind of thinking really holds us all back.
Oh, yes. Well, Debbie, are you ready to hop on the soapbox?
I suppose so. I'm not much of a ranter, but occasionally it'll happen.
All right. Well, hold on before you start. Let's put you on the box first. All right.
Am I on the box officially?
No, you are.
Oh, there I am. Okay. My box. I guess I'm just fed up, y'all. Like, that's where I'm at. I'm fed up. As Robyn mentioned earlier, she and we've been doing this work for over 10 years now, trying to convince our state legislature and Governor Ivey and Governor Bentley before that to expand Medicaid. And I'm just so tired because we have all the facts on our side. You know, there's so many benefits to Medicaid expansion. We can afford it, especially with the new incentive that we just got from the American Rescue Plan Act. The numbers are there. It'll actually save our state money. But most importantly, it's going to save lives. Everybody knows somebody who has struggled with health insurance coverage. Everybody knows somebody who needs coverage and can't get it. And it's time for that to stop and go ahead, do the right thing, and expand Medicaid in our state.
Yes, thank you, Debbie. Look, and you mentioned something, Debbie. I don't know, we broke this down for our listeners and viewers about the money that we received recently. Can you give us just like a little bit of information about that?
So there has always been a huge financial incentive for our state to expand Medicaid. Currently, Medicaid, we only pay 70% of the cost, and the federal government pays 30%. And we have a much better matching rate from the feds than a lot of states because we are a very low-income state. When we expand Medicaid, the newly covered folks, it'll actually be even less expensive. The state would pay 10% and the federal government would pay 90%. So we pay 10 cents on the dollar to cover 300,000 people. I think it's a great deal. But our state has still said we couldn't afford it. So when the American Rescue Plan Act passed last year, Alabama and a lot of other southern states went to Congress and said, please make it even easier for our states to expand, bring back more support so that in the first few years of expansion, our states have more resources to do it. And what they gave us was an additional 5% matching rate for Medicaid. And the numbers are wonky. It's hard to explain. But basically, over the past 3 years during COVID, we've had an additional 6% matching rate just because of COVID. And the impact we've seen on our state budget has been we have an additional $300 million just in our budget this year alone from that boost. That will more than pay for the 10% that we have to cover to enroll all those new people, which means it's revenue neutral. We can afford to expand. We don't have to raise taxes to do it. We've got the money right now because the federal government said this is how critical it is for y'all, Alabama and other states to expand Medicaid.
Thank you, Robyn, for breaking that down. So I know, our listeners and viewers, you may be wondering how you can stay connected, get involved, and stay informed around, this fight and other social issues. Definitely tune into future A Different Frame episodes. The podcast is streaming on all platforms, and you can catch the podcast, the video version, on social media platforms at AV Progress in our website, www.alabamavaluesprogress.org. So like, follow, subscribe, and share. We'll also be plugging you in to some partners who are doing this fight, such as Cover Alabama and Arise. So to stay connected also with the latest news and updates regarding issues in Alabama happening, during the legislative session, please also sign up for our legislative news and happenings. You can do so by visiting bit.ly, that's bit.ly facebook.com/session updates to stay connected and informed, and also receive updates on when the latest vlogs and podcasts are being posted, and as well as our partner events. And that's all for today's episode of We All Need to Be Covered. Why is the Alabama Legislature holding out on healthcare for many Alabamians? People really want to know. So join us for our next episode on Alabama's need to abolish its grocery sale tax. We'll be joined by Akeisha Anderson and Carol Gunlock from Alabama Arise. Thank you all. Tune in next time.